Overdose deaths involving opioids have spiked in recent years, largely due to the opioid epidemic. In 2018, roughly 65,000 Americans died to opioid overdose, and the average national rate of overdose deaths involving opioids was almost 15 deaths per 100,000 persons. In New York, it was 3,200 opioid overdose deaths, or roughly 16 deaths per 100,000 persons. Long Island has been hit hard by this crisis and lost 600 people from opioid deaths in 2017. That year, Suffolk County had the second most opioid-related deaths in the state. According to a report released by the Opioid Crisis Action Plan Task Force, an estimated 45,000 individuals on Long Island are living with opioid addiction. Today, we speak with Robert Kanter, a parent advocate who shares how his intervention and approach fueled his daughter's decision to seek recovery from substance use disorder. Now, he advocates for families and individuals who may be facing similar struggles. Please welcome Robert Kanter.
Thank you for having me. Appreciate your time. I want to thank your hardworking crew and your executive director, Erica Bradley. Let's save some lives.
Yeah, let's definitely do that. Tell me about your daughter, Sasha, and her substance use disorder.
Sure. Sasha is currently 25 years old. The signs of her substance abuse began when she was a senior in high school. To fast forward to about a year and a half ago, she bottomed out. She was using heroin and opioids, locked in an apartment with a person that was dealing her drugs and using them with her. And my former wife and I intervened from a place of love, from a place of support, and I believe from that intervention, and I really won't call it an intervention, I'll call it a discussion, she then made the decision to seek her recovery.
Your daughter has been sober now for how long?
I can tell you with her permission, a year and a half.
When she started exhibiting signs of use, what signs were they, one? And two, what was your approach then versus to the point what fueled her recovery?
Right. So when Sasha was in her last year of high school, her grades started to plummet. Her attitude started to change. She was more irritable. She was coming home late. She was associating with a different crowd of young adults. She looked different. She didn't look physically well. And something was up, but at that time, my wife and I didn't have the tools and the knowledge we have now, so we chalked it up to what they call senioritis. And the fact that this was an off year for her, she had already been accepted to college, and so that's what we thought. And we didn't pay it much attention. Little did we know, but at that time, we figured she was a typical 17-year-old.
Right. And for anyone who's watching, senioritis is pretty much like you're in your last year of school, you've done everything you need to do, you're in college. So typically, like, whatever, right?
That's it's a year old.
So when you realized at some point further down the line after she graduated in college that things were not what they seemed, what was some of the triggers for you to be like, oh, we really need to intervene? And as you said, it wasn't an intervention, it was a discussion. What were those things for you?
Well, she subsequently dropped out of college. She subsequently had jobs, she had employment, and then started getting fired from those jobs. And she just kept declining in terms of her social interaction with individuals, her productivity in society. And as I mentioned to you a year and a half ago, she found herself in a place that was very frightening for all of us. And you can imagine what goes through the mind of a father of an only child when she is basically locked in an apartment with a drug-dealing boyfriend and not coming out. And not coming to family functions like she used to, not speaking to my wife and I on a frequent basis, and not sure if my daughter was going to survive or if I was going to get that phone call that so many other parents unfortunately have gotten.
When you saw this pattern, and you realized you had to go in and talk to her with your ex-wife, What was different in this conversation? Because I'm certain you've had several. What was the difference with this conversation versus others?
When I realized it was a life and death crisis for Sasha, I called my now former wife and I said to her, if things continue to go the way they are, she's going to kill herself. And I think our approach previously, one of punishment and one of not treating her like a human being, wasn't working. Because every time we took that approach, we pushed her away. So I said, we need to come together as a family and appeal to her that we love her, that we understand that she's not a bad person, but a sick person, and that we have her back, and that we're here to travel with her through this journey and support her. That was really the turning point. That's what got her to come out of that apartment and sit down with us at that diner and have that loving family conversation, which really, I believe, launched her journey into recovery. So the three of us spoke at the diner. Sasha was high on heroin when she was there. We all cried. And we came together as a family. And again, there was no approach of punishment. There was no approach of stigma. This is, we love you. Being in recovery myself and being in 5 rehabs and going to the most sordid places you can imagine, a place where no individual should have to go, I already understood recovery. And I was able to share that information with her. But I also had to do research myself on currently what is the state of affairs in recovery and where she should go. So I had that benefit, and I incorporated that with my wife into that conversation. And we said to her, Sasha, why don't you just go home? Or why don't you go home, pack your bags, and let's take a ride to detox. If you don't want to stay, that's fine. And she left, and my former wife and I sat there and we were crying, and we didn't know what was going to happen. And we didn't know if we had pushed her away more or if she in fact was going to call us and say, yes, I'm coming. And I guess something clicked with her. She had developed that emotional fortitude and was able to extract herself out of that apartment. She did throw her belongings quickly in a bag. She came to the diner, and off we went. Now, the boyfriend tried his hardest to stop her from going. And she had that desire, I believe, from that conversation to say, whoa, back off, this is my journey. And from there, we drove her to detox, and she stayed there for 4 days, and under supervision was able to withdraw from the heroin and the opioids. She didn't spin dry. Spin drying is a situation where a substance abuse user goes into detox purposely, knowing they're going to leave, for 3 or 4 days to lower their resistance to the drug, so that when they go back on the street, they're buying less of that substance to get the effect that it would cost them more to spend on those drugs otherwise. She chose to go to a 28-day inpatient rehab. We found a wonderful one, actually one I had been to in Connecticut. She finished that 28 days. She got her footing. She relaunched her recovery. She went to a sober living home where she reintegrated into society.
When did you realize that this was bigger than your family to get involved?
So obviously the harrowing experience with Sasha always stayed with us, and we have these wonderful sober conversations to keep it fresh in our minds. 4 months ago, and I told you I had a marketing company years ago, which I trashed because I didn't have the presence of mind. In the late 1980s, when I was bottoming out and spiraling out of control, I had also a very successful marketing company. I was at the pinnacle of my career. I was asked to appear as a guest on the Geraldo Rivera show as a panelist, and decided that 2 days before I would use cocaine and drink massive amounts of tequila and show up on that show and show very high and very drunk, and I humiliated myself, and I humiliated the industry, and I could never give another keynote speech again. So I started this, and this time I was a sober man, and as I went through the process and networked and learned about the opioid epidemic, as I learned about the space, as I learned about the epidemic, somewhere along the line I realized that what was more important was to be a parent advocate, because I would be a hypocrite if I just rested on the laurels of the fact that my daughter and I are a success story and didn't really carry a message to those families that are struggling with loved ones that have substance abuse. So something occurred when I learned about this epidemic and the amount of individuals overdosing, that really what's required is nothing short of a social movement, of destigmatization, and that I needed to contribute and in whatever I can do to disseminate the information and the hope for families. And one thing I will mention is that it really is an uphill battle because it's a very fractured scenario. There are at least 1,000 different organizations around the country doing wonderful work, but they're all taking little bites, okay, out of the epidemic. And they're doing great work, whether it's treatment-wise or whether it's legislatively, but a lot of them don't know what the others are doing. It's confusing, it's complicated, I can't even understand it. And if I'm a parent advocate and I can't understand it, imagine the legislator in Ohio who doesn't know what a test kit is, doesn't know what a sober community is.
How did you become a parent advocate? How did you train for it? Did you take classes? Did you go to school for it? What was the process like?
The process is that I felt that I had an obligation to do what we're doing here. I'm from Brooklyn, I have a big mouth, and that was my training. It really was. There wasn't any formal training. The volunteer work that I do also gave me a lot of guidelines on how to speak appropriately on behalf of organizations, but also on behalf of the epidemic. A lot of research. I've done public speaking before, and it really just morphed into its own life, and has just become a very, very passionate subject for me.
How did you hook up with Senator Gillibrand and get involved with the My Family Support Services for Addiction Act?
I do volunteer for a number of organizations, one of which is the Center on Addiction, and they do wonderful work. And the individual I work with there is Courtney Hunter, and she handles legislative matters for the Center on Addiction. I also work with the executive director, Emily Feinstein. Courtney spent about a year drafting the actual legislation, the Family Support Services for Addiction Act, and then submitted it to the senator's office, and they tweaked it, and then she introduced it to Congress. During that process, the senator's office asked me to tell this story and to give them information, so they did a phone interview with me. Then the senator had the press conference about 3 weeks ago introducing the legislation, and it's bipartisan. And then I spoke and I told my story, and then from there my advocacy has just continued, to snowball, and now, appearing in the media is the next natural step. So I am working with the senator's office in promoting the legislation. The legislation provides for family services for the families of those that are struggling, which is systems navigation, it's peer-to-peer, services, it's support groups, it's educational training. It earmarks $25 million over 5 years for those current services and then creating new ones. And the legislation currently has been referred to committee, which is the Health Committee, Health, Education, Labor, and Pensions. So there's good momentum, but the wheels of Washington turn very slow. And the hope is that this legislation will become part of larger legislation, and there'll be more funding, because quite frankly, $25 million is a drop in the bucket.
Right. But let's talk about this act, because it's monumental in its gravity, right? Because it's bipartisan. And it also offers things that, you would think is already available to families who are dealing with substance abuse disorders, right? And that's, you said, peer-to-peer support. So being able to go somewhere and get help, right? Also identifying how insurance works with your family to get rehab, is that right? Or detox, because those aren't things that are readily perhaps available with your insurance provider. Or even support for families, because often enough, it's fair to say that, if you're dealing with this the first time in a family, you don't have the tools, right? Or you don't have maybe the emotional support to deal with this. It provides that as well, right?
Correct. It provides a variety of services. The fact that a high-profile senator is introducing this legislation increases awareness so that families will be informed as to what's available to them, and it starts conversations. And that's really the key of what I've been speaking about, is to have these loving, destigmatized conversations between the families and their loved ones, and to talk about resources. And so in this broadcast, if one person hears about this legislation and they can talk about it at the dinner table or the Passover table, you're saving lives, because you're starting very healthy, life-saving conversations.
Let's talk about your use of language. You're very specific, and you've also taught me in our pre-interviews that we're not using the word junkie anymore. I mean, we would never use the word junkie here, but you know, we're not even using the word addict. We're using substance use disorder, substance abuse disorder.
Substance use disorder.
Substance use disorder. And you're very stern about that. You know, like we have to change the language. It changes the conversation. It changes the approach. How do we continue to really spread that message, and what does that do for our people or families who are struggling with that type of issue?
Great question. There is a wonderful website called changingthenarrative.news, and it's put together by academic individuals, journalists, and for every word that's been used, such as junkie or addict, they have alternative verbiage that you can use. This all goes back to the issue of stigma and the issue of using words like junkie or addict, which portray that individual that has a disease. You know, addiction is not a moral failing. They have a disease, and to portray them as individuals that are struggling with an illness, that are not bad people, that are sick people. As I said before, the destigmatization of addiction, and again, I'm used to using this word, so because I've been using it for decades. But if you're not going to destigmatize it and have these loving conversations with families, you will never reverse an epidemic. It just will not happen. The society has to understand and speak in language that is not derogatory to this individual that is suffering.
We're starting to see that if we also approach the behavior and how we engage people with substance use disorders and how we engage their families, we can reduce, attempt for them to get back into substance use. One of the things you've mentioned is the Portugal model. Can you tell us a little bit more about that?
Sure. Roughly 20 years ago, Portugal, the country of Portugal, a country of 10 million citizens, had a heroin epidemic. And they did something very bold and very drastic, and that is that they pulled the epidemic, or addressing the epidemic, out of their legal system and into the Ministry of Health. And the idea was to not come from a place of punishment, but come from a place of helping the drug abuser and giving them tools, what's called harm reduction tools. If an individual, a drug user, was caught with drugs, they're required to appear in what's called a dissuasion committee, comprised of 3 individuals: a physician, a social worker, and an attorney. Those 3 individuals didn't shake the finger and say, okay, you can choose from this jail, and this jail. They said, we understand you're suffering here. We want to work with you. We want to provide you with tools. You want a home-cooked hot meal? We got you covered. You want us to drive you to a detox? We got you covered. You want us to call your family and get them involved? We got you covered. But even if you're not ready to stop using substances, we still want you to be safe. We're going to tell you where you can go in the city to use, where it's been shown that it's safe. We're going to give you test kits so that if you're in the right presence of mind and you've bought those opioids or that heroin, you take that test kit and that liquid and you shake it up and you say, oh my God, it's cut with 30% fentanyl. I'm not going to consume this. I don't want to overdose. And maybe a card that you can put in a wallet, and that card has a suicide hotline phone number or a warm body on the other side where they can talk them off the ledge. They reduced their epidemic by 75%. They came from a place of humanism. They encouraged the families to talk to their children. It wasn't from a place of punishment. And that's the message here. So 75% reducing the epidemic, so you do the math, 75% is 65,000. Now, we're a country of 350 million people, and it's much more complicated than that. But again, it goes to the point of treating these individuals that are suffering from a place of humanism.
Offering a place where we create this idea of humanism with someone who's using also means being prepared to support them and help them in their hour of need. And if I'm right, you have also completed a Narcan training.
Right. So Narcan here is opioid prevention. It's if you take a look at it, some of you may know what it is, many of you may not. It's something you can carry in your purse or in your briefcase. The training is extremely simple, and what it is basically is a medication that you can carry with you, and if you suspect that someone has overdosed, if they're non-responsive, you take it out of the packaging, you squirt it, and if they don't respond, you can squirt yet another application if you happen to have two, and whether it's before the incident or after, you want to have called 911. That's a lifesaver. Okay. Now, my daughter has had one close friend and two others that have overdosed. I'm a big proponent of having the young adults carry Narcan. Of course, that's another controversial issue. But as a parent advocate, I need to be as prepared as possible. I sent one to my daughter. I sent one to my daughter and her boyfriend. They're more than happy to carry it. And, you know, these young adults have their friends dying in their arms. And if they had Narcan, you know, with them, it saves lives. These are one of the tools that we can all use to save lives.
And to be clear, do you need a prescription for this?
You don't need a prescription. You can almost always get them for free if you contact the Department of Health. You really don't need to go to the pharmacy and pay whatever it costs. Those are available for free.
I knew about Narcan. I didn't know about this new approach in a sense of really coming from a place of love when dealing with someone who has substance use disorder. How do we spread the message? Every
time an interview like this is done, every conversation or interview on a CNN, every segment saves lives. And the parent advocates and the parent advocate community are very appreciative of that, okay, because I'm allowing, you know, you're allowing us to speak and start conversations and save lives. It would be optimal if the media would cover this topic and this epidemic on a more frequent basis and portray it in a more positive light, to destigmatize, to use that new language, to disseminate information that there is new legislation. There are so many things. So let me give you an example about the sober community where my daughter currently lives. When she finished sober living, she decided to stay in that community. And this is a community, I'm going to say maybe of 200 young adults. It's a town in Connecticut, but what they've done is within that town, they've created more or less like a college campus. So they are up at 7 a.m. in the morning. They attend their 12-step abstinence programs meetings. And by the way, I just have to interject, as I mentioned to you, I support every path of recovery that is out there because there are many, whether it's harm reduction or smart recovery or neuroplasticity or the matrix model, if you're talking about, you know, meth, which is now on the rise, which is going to be the next thing. So they attend these meetings and they work for local merchants, and they text each other all day, and they fellowship, and they go to the movies together, and they support each other. What a wonderful opportunity for the media to get those cameras out there and to cover what a sober community is, because most of the country doesn't know what a sober community is. Why is that important? Because if take my daughter for an example, she went to detox, then to rehab, then to sober living. Well, if there's a family and says, well, that's wonderful, but now what? Oh my God, they're going to come home. They're going to be back to where they were using their drugs. The boyfriend is here. Well, now here's another option. Here's more information. Here's more hope for them. But you have to cover that. There's plenty of content to cover in a positive manner where you can change the language, destigmatize, let families know about the tools that are there, and ultimately change the narrative, have this paradigm shift where you can really try to make a dent in a prolific epidemic. For the person who's watching, how do they join the movement? How do they get involved? Whether they have someone who's suffering from substance use disorder, or whether they're just like, I understand and I want to do something. Legislatively, as it relates to the Family Services Board, its billing is S3179, HR 5572, so the Senate and the House, in case anyone wants to go onto the official government websites to research it. On the Center of Addiction link in their news section, under the press release that you'll see when Senator Gillibrand introduced it in Hop Hog, which is where I spoke, there is a link. You can respond to the link and write letters to your legislators. What I would first suggest to family members and to everyone is to do your research, to go online and to research the Center on Addiction, study the epidemic and learn the language and learn what people are doing. If you can volunteer, wonderful. If you can donate, that's fantastic. When you're armed with these tools, talk. Start conversations. Talk about the shame. Destigmatize it. Take the power out of the shame. Talk to your children. Talk to your rabbi. I am of the Jewish faith. We do not discuss addiction in the Jewish faith. There is a large Jewish population in your viewing audience. If I touch one family of the Jewish faith and they're struggling with addiction and they might not have had an outlet to speak before, or if they go to synagogue on a high holy days, during the high holy days, and the rabbi includes this message in his sermon, guess what? That family member, that mother or father might say, you know what? I'm going to give that rabbi a call. I need to speak to someone about this. Maybe we're going about this the wrong way. It's this dissemination of information that's critical. Talk to the educators. Talk to your community leaders. Talk, because it's an epidemic and we need to talk. And you're going to find two types of individuals. Someone like yourself that get it, that are willing to focus on me, and that understand the need for this interview. And then you're going to get the other person who you might as well be speaking pornography to them because it's dirty and it doesn't affect our families. You know what? We don't want to have this conversation. Those are the people you need to reach. Have these conversations. We're talking about an epidemic, and don't think it can't happen to your child, because whatever you think your child knows, they know just a little bit more. Don't forget they have access to the internet. They know where to get the drugs, and they talk to their friends, and sometimes they arrive at a place in their lives where they're in a lot of pain, or they have anxiety, or they have that social pressure, and they just want to get to a happy place. And if they're not getting it from their family, they may turn to drugs. You don't want to get that phone call. The phone call I got from my daughter was a good one. She said, okay, I'm going to take this journey because you have my back. The individuals, the couple that sponsored the Narcan training last week, it happened to be at a synagogue. They lost their daughter Zoe. They got that call you don't want to get. And so the purpose of these conversations is to try to appeal to families through the media and through education and say, you might want to switch up that approach. Because if your child is out there and you're not giving them their family of origin, guess what? They're going to go to the other family. That's the family on the street. You don't want them to be there.
How do people get in touch with you?
Well, they're more than welcome to connect with me via my email. I will gladly bring them together with these organizations. I will gladly speak to them. I will arrange for them to have a coffee with an individual that they may want to speak to. Because of the stigma and the embarrassment, there are many families that don't want to be out there. Let's have these conversations and save lives. And that's why I'm here.
Okay.
And thank you, and that's why you're here, and you're saving lives right now.
You're very welcome. It was a pleasure to have you here, and I'm glad that we can be a part of the movement.
Thank you so much.
If you have any questions or comments about our program, please send us a note at the email address on your screen, or send us a note on our social media handles. After the end of credits, there will be resources for you or anyone you may know who may be dealing with a substance use disorder. I'm your host, Kaleen Leveille. Thank you for watching.